Hello, and welcome to the first episode of the RTI Health Advance series on social determinants of health. RTI Health Advance is a consulting firm anchored within a trusted research institute, and we deliver the evidence based solutions business and clinical leaders need to advance healthcare for everyone. In this series, we'll be covering current challenges with social determinants of health data and new approaches to incorporate better data to produce better health. My name is Denise Clayton, and I'm a health economist in RTI Health Advance, and I'm joined today by my colleague Lisa Lines, a senior health services researcher. In today's episode, we'll be talking about some of the current challenges around social determinants of health data. To get us started, Lisa, can you tell us a little bit about the current challenges around risk adjustment and quality measurement with respect to social determinants of health and the impacts of these challenges?
Sure, Denise. So, as we move from paying for volume to paying for value, risk adjustment becomes even more important. And current risk adjustment formulas and performance and quality measures mostly don't take social determinants of health into account. And what we mean by that, social determinants, we're talking about the conditions in which people are born, age, grow, live, and work. So it's about educational quality and attainment, healthcare access quality, social and community context, economic stability, food insecurity, the neighborhood and built environment, housing, environmental quality. And these things have an independent effect often over and above the individual level social determinants of health. So it's really important to take these into account. And when we don't, it can really lead to unintended consequences. So practices with lower risk patients can get rewarded, and those with worse off patients lose out. Providers often feel they're penalized for factors outside their control. Payers and networks have incentives to enroll lower risk members, and having a lack of good data on social determinants of health can bias interventions toward lower risk populations and potentially less benefit.
Great points. And Lisa, when you mentioned that payers and networks might have the incentive to enroll lower risk members, that of course then leaves higher risk members with lower access to care, which is really the last thing they need. The other thing I thought that you said that I thought was really interesting was, this typical risk adjustment formulas use really basic demographics like age and sex. And then they use the diagnoses or hierarchical condition categories, better known as HCCs. And maybe there's something for an indicator for dual eligible, but none of those social determinants of health you mentioned are really incorporated either individually or in some aggregated kind of measure. I wanted to ask next about the current options for area-based indices and how well do they predict health outcomes?
Yeah, there's not a lot of great data out there on this, but I think it's really an evolving field. But there are a few indices that are out there that are in common use. The Social Deprivation Index has 7 variables taken from the census. The Social Vulnerability Index has 15 variables, again, all census-based. And then the Area Deprivation Index has 17 variables. And that's pretty much it. And actually, the area deprivation index is not valid to be used at the zip code level. You have to have 9-digit zip codes. So that's the census block group level. So yeah, if you're looking around for something that you can use with zip code level data, you're really stuck with just 2 indices that really don't capture a lot of the nuance and variation. And none of these indices actually do a great job of explaining health outcomes in terms of what we've examined so far. At best, maybe 65% of the variation, but often much less. And that's why we created the local social inequity score. We draw on over 150 variables, and they're all related to health based on the conceptual model.
Yeah, can you say a little bit more about what that score is? What's the level and what goes into it?
Yeah, so the LSI is a measure explaining health outcome disparities or inequities in small geographic areas using predictors related to social factors. And the geographic levels that we have the score at are the census tract, and that's a little bit bigger than the census block group, but definitely smaller than the zip code area. Zip code tabulation area, or ZICTA, is another level that we have. It's not as great because when you get to larger geographic distances, you do end up with a lot of variation. and averages across a large population are less useful than small area. But we do have the scores available at the county level, the ZICTA level, and the census tract.
Yeah, thank you. And we talked a little bit about having a conceptual model here. Why is it so important to have a conceptual framework when you're doing machine learning? I mean, having 150 variables sounds great, but it's important that we're not just throwing in everything but the kitchen sink.
Definitely true. And when we're dealing with machine learning, having a conceptual model is really important because otherwise you can risk introducing some very black box type of issues where you don't really know what the score is built for. You don't really understand why the variables are in there. So everything needs to be selected very carefully. And spatial autocorrelation needs to be taken into account. You need a really good team with health geographers and data scientists involved, and people from social work and justice and education. So it's really quite an undertaking to bring something like this into being.
Yeah, I can appreciate that. And, from the work that we've done looking at the outcomes, it's really impressive that when you do bring those people together, you do a really good job of explaining the health outcomes of interest. So when we've looked at life expectancy at birth and also infant mortality, and in those cases, the LSI explains a lot more of the variation than the other area level indices that are available do. So the LSI explains, at least 75% of the variation, but oftentimes more than 90% of the variation in these outcomes. So it's really exciting work and can be applied in a lot of different ways to improve health outcomes. So I want to say thank you, Lisa, for joining me today. I think these insights are really great and will help those working to improve health outcomes. And thanks to the listeners as well for joining us today for the discussion. Stay tuned for more episodes in our Social Determinants of Health series. If you'd like to learn more, you can connect with us at rtihealthadvance.org. We're happy to talk with you individually.